I'm Delaney Campo. I'm the Health and Wellness Director here at LCM. And joining us this morning is Dr. Devi Miron Murphy from the School of Psychiatry at Tulane University. And we're talking about emotional regulation because that was something that was reflected on our caregiver wellness survey that y'all wanted to learn about. And so we immediately thought of Dr. Devi to talk about this topic. So that's,
Great.
and I was just having her kind of explain what is emotional regulation.
Yeah, so it's really simple in terms of the definition. It's just the ability to recognize, manage, and respond to feelings in an appropriate way.
Mm-hmm. Yeah. So recognize, respond in that appropriate way. So right. I think sometimes we see people responding in maybe inappropriate ways.
Yes.
So how do we develop those skills of appropriateness?
Right. So for infants, I was saying for infants and young children, they're going to do that with their caregivers.
Okay.
And so caregivers have the opportunity to kind of reflect on what feelings am I okay with? So, what feelings do I sort of welcome that my child expresses? What feelings do I feel like I need to kind of shut down? What feelings do I want to avoid? Because kids pick up on that and they learn the same ways that adults have. So we want to try to be, open to all emotions, help the child recognize and label their emotions. So happy, sad. In the beginning, it's simple: happy, sad, mad, scared. Those four basic emotions. And then as the child gets older, you'll label more complex emotions like shame or, embarrassment. Confused, it's always good to say, maybe you don't know how you're feeling, maybe you're feeling mixed up or confused. And so, around like school age, we want to see kids being a little more independent with being able to identify how they're feeling, maybe use some kind of coping skill like deep breathing or taking a break. A lot of classrooms have like a cool down corner they can go to, and they help the child, identify when they're having a feeling that's sort of getting in the way of them being able to do a task. Because that's what this is about. It's like, it's okay to have feelings, but we don't want it interfering with like daily activities. We don't want to have like the way we respond to our feelings interfering with our activities. So emotion regulation is the way that a child is able to manage the emotion without sort of, without interrupting activities, without interrupting home or school activities, being able to go to a caregiver if needed or a teacher and say, I'm feeling this way. I need something. I need a break, or I need to color, or something like that. And then, looking ahead, we have school age time, like elementary age, is kind of a nice kind of like relatively quiet period for emotions. Kids have sort of learned how to identify them. Typically developing kids will, be able to use good coping skills around that time. And then we get into the preteen adolescence where, puberty's happening. There's a lot of, hormonal changes, and that can lead to more emotional kind of fluctuations.
Right.
And so we sort of want to start over with our older kids and help them identify that, and maybe they need to develop some new coping skills that, that they didn't have when they were younger.
Yeah. How would you recommend, I guess, that emotional literacy piece?
Yeah. So I think it's, naming them, giving them language, saying it looks like when, so-and-so took your toy, that made you feel mad. And then and then you hit them or whatever you did. So kind of first helping them identify it, and then, over time you can say, so when he took your toy, how did you feel? And having them identify that.
Okay. And
then say, okay, well, it's okay that you felt mad, but it's not okay to, hit the child. What could you have done differently? And kind of reflecting on that situation. Hitting hurts, so let's think of something else you can do. If that happens again, you can ask for the toy back. You can take a breath. You can take a break. You can play with another toy. You can tell the teacher. There's so many other choices kids can have. So emotional regulation really a lot of times is about behavioral regulation too.
Right.
So what are you doing with your behavior when you have an emotion?
And again, that's where those coping skills come in.
Right.
So at what point should a caregiver be concerned about their child's emotional responses?
Yeah, I think when it's getting in the way of daily activities or functioning at home or school. So I think parents pretty much know when this is a problem. For the most part, when your child is an externalizer, when they sort of show their behaviors and other people can observe them, then it's really easy to tell when there might be a problem, because the child might be having tantrums or might be hitting or be aggressive or be really shut down and not want to play, things like that. That could just be not being able to cope with sad feelings. So when it's getting in the way of functioning at home, so if you're spending a lot of time with emotions, like the child's having a lot of, as we say, big feelings,
Right.
a lot of feelings that they're not able to manage. And it's really, it's delaying dinner or it's making them late for school. That's when you're seeing that maybe emotion regulation needs to be we might need to pay more attention to it. And it may just be due to a transition. Maybe it's just a period of time where they're having more trouble, but we can still use that opportunity to teach good coping skills. And then, or maybe it's okay at home, but you're seeing it at school, and so
Right.
the teacher would need some support in helping the child regulate. Maybe you can share strategies that you use at home with the teacher, and certainly if you're seeing it in multiple settings, there could be a real problem where we want to maybe even go get evaluated by a mental health professional to see what might be happening, because there are certainly disorders, mental health disorders that can
Right.
be happening for the child, that the child might really need more professional support. Yeah.
Yeah, so it's not that the child's having feelings that's the problem. It's when those feelings are delaying, normal functioning, things like eating, bathing, playing with friends at school, like social functioning.
Yes.
And at that point, we seek out maybe that extra support.
Yes, so it's the behavioral responses to the feelings. So, I often am saying to kids, it's okay to be sad or it's okay to be mad, but it wasn't okay to,
Right.
do X. Wasn't okay to throw. Let's think of something different we can do. So it's really the behavioral, when
Right.
those behaviors are interfering. Yeah.
And so we kind of touched on it a little bit earlier, but what are some good maybe coping skills or interventions for different age groups?
Okay. So infants and young children, they're going to need a lot of touch. So lots of holding, cuddling. They need to know they're not alone in their feelings. So, we know newborns can cry a lot, infants cry a lot, and they really need to be able to know that their caregiver is there for them, to create the sense of security, and that can also help with attachment. So that's the strategy for infants, is really holding them and talking to them, letting them know that you're there, and not sort of leaving them off to manage it on their own, because they really can't. They really can't manage it on their own as infants. They need their caregivers. But then as they get older, like toddler age, two or so, they're more independent and they're walking around, and so you can sort of help even start teaching them like deep breathing,
Right.
like around age 3, labeling their emotions, muscle relaxation, so tightening their muscles and being sure to relax them, breathing from the diaphragm. Kids are learning those strategies earlier and earlier in schools, and it's really nice to see that. Like
Yeah.
kids have all kinds of different ways of doing it. Rainbow breathing, different types of fun ways that kids are learning how to regulate at school. It's really nice to see, and then they end up teaching their parents at home.
That's awesome.
So there are lots of strategies they're learning, and just reinforcing that. And having the child do it before the feeling gets too out of control.
Yes.
So another piece of emotion regulation is being able to identify, like, how much of a feeling am I having? Like, gradations of feelings. Is it little, medium, or a lot? For younger kids, it's just little, medium, or a lot. And you want to help them identify when they're starting to get a little bit upset, like right at sort of the beginning, and it's kind of starting to escalate. That's a good time to use a coping skill, doing deep breathing. Once it's a big feeling, it's really hard to. You sort of sometimes have to wait that out.
Right.
They're not going to listen to taking a deep breath. or doing any other kind of strategy at that point. So we really want to try to catch it when it's a little bit, more manageable. But that requires the child to be able to communicate that,
Right.
that they're, starting to feel upset. So as they're starting to get upset, say, well, maybe we should take a break, maybe not use the word timeout, because sometimes kids associate that with punishment, but let's take a time in. Let's take a time in. Why don't you come sit on my lap, and let's do some breathing, because it looks like you're starting to feel like maybe like a medium mad. So let's do that now. And
Right.
So over time they start to identify like, yes, I'm having big feelings, or I'm having a big scared feeling, or medium, or little, and I need some help.
Yeah, so even not just the word, but the amount is something that's really important.
Yes.
Yeah. I think that one thing that we've been saying is that the caregiver really needs to be in tune with their child's emotions.
Right.
So how do caregivers help themselves to emotionally regulate? Because
Yeah.
I think that's a big part of it too, where if we're teaching these skills as adults, how do we, if we don't have that language, how do we do that?
No, that's a great point. Yeah, so many of us didn't necessarily get, that kind of emotional literacy, from parents or from school as we were growing up. So it is important to identify, as I was saying earlier, what are some feelings that we're comfortable having? What are some feelings that we, really try to avoid? And how do we express those in different ways? So, for example, in some families, it's okay to be mad, it's okay to yell, it's okay to stomp your feet around the house. That's just how we communicate. We're always like expressing our feelings at a really high level. But in other families, it's like, no, if you're having that feeling, you go to your room and you deal with that there. And that's, I'm not judging whether that's bad or good, but it's just something to be aware of, that, you may have different tolerance for different feelings. We want to ideally express to the child that it's okay to have any feeling, any feeling. Right. Anger's okay. Anger's okay. It's a normal emotion. Everybody feels angry. Fear is okay. It's okay to be scared. A lot of times boys in particular may be taught, you can't, you can't be scared. You got to be brave. So, but that's a normal emotion, and it's healthy to feel fear. I mean, these are basic emotions that over time in evolution we've developed because there are reasons. There are actual threats in our environment, and we want to know when we're afraid of those, and we want to, be able to take, precautions if needed. So, we want to ideally be able to teach kids that it's okay to feel any feeling. It's just the way that it's expressed is what we want to really work on. And so, for caregivers, back to your point. We want to check in with ourselves.
Right.
So can we identify how we're feeling? Especially if our child is having a tantrum, for example, we may need to take a break. And so that's fine. That's fine to leave the room, for example, leave the room if you need to take a break. But it's important to tell the child you'll be back.
Yes.
So let's say you're trying to get ready in the morning and your 4-year-old is not getting dressed, and you're saying, okay, I need you to get dressed, and they're rolling around and doing other stuff and getting upset, and you're getting, you're noticing, like for adults, it's like a 100-point scale, like, more like, are you at like an 80, 90? And if so, you want to take a break and just say, I'm going to take a break. I expect you to have your clothes on. I'm going to leave, but I'll be back. I'm going to take a break. Mom needs a break. And then you can come back and say, deal with it there. Like if they've done what you asked them to do, great. If they haven't, then at least hopefully you're in a calmer place to be able to, be more patient to support the child to do what they need to do. So I think breaks are fine. Time ins are good. That might be a nice way. So when I say time in, I mean with the child, like holding the child. That might be, it looks like we had a little bit of a, a rupture, or we had a little bit of miscommunication. Why don't you sit with me and let's talk about it. That could be a nice way for both to regulate, sort of that co-regulation. And then, in general, I think adults can always practice like good self-care in general to have a lower level of stress, so that we have more patience for our kids, and that we're able to regulate our own emotions when needed. And so certainly taking time for yourself is really important if possible. Whatever you find relaxing, exercising, reading, talking with a friend, things like that can really help.
Right. Yeah, so it sounds like you were saying really one is knowing what my tolerance level is for emotion. So if I'm a person that struggles to express anger, then knowing that when my child is angry, that's going to be extra triggering
Exactly.
for me,
Yes.
with any of those emotions, right? And then it's okay. My kid is having a big feeling, having a meltdown.
Yep.
How do I take that time in, take that break, and then come back? Yeah, and then I love that kind of co-regulation piece where it's like, I'm here and I'm here with you. Like mom's also frustrated,
Yes.
so let's hold hands through this big emotion for both of us, and kind of teaching that along the way of I also feel this way.
I'm glad you brought that up. So it's some parents feel like they need to hide all their emotions from their kids. They don't want to burden them with their emotions, but I think it's good to actually say when you're feeling a certain feeling that you can say, I'm feeling a little mad too, or if something really sad happens, it's okay to say I'm feeling sad too, and let your child see how you handle it. So I'm feeling sad about this. So I'm going to go talk to daddy, or I'm going to go talk to my friend, or I'm going to go for a walk. And then, yes, if it's something with the child, you can do that together. We don't want to go to our children for comfort. We want to make sure that, we're going to other adults if we need people. But in terms of like repairing something between a child, it is nice to do that together.
Right.
Yeah.
One thing that came to mind when we were talking is I love the book Atlas of the Heart by Brene Brown, which is just a big book of emotions and experiences. So if we're struggling to learn, I think that's just one great way is to increase our own literacy of our emotions, and that was a good resource for me.
Great.
That I've found.
Yeah, and of course as adults we have such a range of emotions, so many nuances and complex emotions, and kids may be experiencing some version of that, but we as adults need to really be able to identify those different feelings. Yeah.
Right. Awesome. Well, I'm wondering, do we have questions from our audience?
We do, and I think I can put two of them together.
Okay.
We had one question about helping children to recognize for themselves when these big emotional blow-ups are coming, and you spoke about that a little bit, but I think maybe recognizing some of the physical things that come along.
Oh, yeah.
And then also, what happens when the parent is not the one who's there to help walk them through that emotional episode? Some of our children may be at school when these big feelings happen, and so can you talk a little bit about helping the child himself recognize when this is coming?
Okay, yes, absolutely. So thank you for adding in the physical piece, whoever brought that up. So we think about emotions in terms of what's happening with our bodies, what's happening, in our minds. And so we can identify that we're having a certain feeling, and then we want to learn to recognize, how does my body experience that feeling, or how do I experience that in my body? When we're doing therapy with younger children, we often will do like a body outline, and we'll have them label, I feel like I have butterflies in my belly when I'm nervous. I notice my fists get tight when I'm mad. And so that's just an exercise to really think about how do our bodies feel. So if we can help, see if we can label that in the kids or identify that, like, I notice your face is getting really red. I'm wondering if you're feeling mad, or if you're feeling, medium mad or big mad. You're shaking. I wonder if you're feeling scared, and that's a time to kind of respond to that. And so definitely helping kids notice in their body how they're feeling. And then some kids express emotions through physical symptoms. So they may be nervous going to school. And so it's, Mom, I have a headache, or I have a stomach ache. And you're sort of on the way to school, and you may, I noticed that you have a headache today. You didn't, or now that we're going to school, you didn't mention that earlier. I wonder if you might be having some feelings about going to school today. And then, they can kind of think about that. Maybe they don't acknowledge it right away, but then the next time that happens, I think yes, I'm feeling a little nervous about school. And so they can express emotions through physical symptoms. Bobos. If a child is coming up and asking for Band-Aids because they have bobos or boo-boos, a lot, that may be a way that they're expressing how they're feeling, or that they need something emotionally, maybe not so much physically, but they just need a little check-in with the person. In terms of helping them do that on their own, so I think that's great. So it starts off with the parents, in early development. But yes, we want our children to get to the point where they can manage it on their own. They're going to be in school with lots of kids. They're not going to get that one-on-one attention all the time. So yes, it's a skill to be able to identify how I'm feeling, where am I feeling in my body, what do I need, and be able to get that for themselves. If they can't go to an adult, what makes me feel better? Is it deep breathing? Is it thinking about a happy place? Is it just taking a little breath? Is it coloring? And being able to do that, but communicating, like if the teacher says, why are you, not doing what everyone else is doing, being able to help your child say, it's okay to tell your teacher, like, you're having a feeling, like, I'm feeling sad right now. Is it okay if I put my head down, for example? And so helping the child do that on their own and reinforcing them for that. If they come home and tell you that something happened, like on the playground, well, did you tell your teacher? No, they were too busy. Well, I'm really proud of you for coping with that and, being able to still do your work. And thank you for telling me that about what happened. You were really brave to manage that. So I hope that answers the question.
Yeah. Do we have no other questions?
That was it. I think we covered it. Y'all were very thorough. And,
Awesome.
I wanted to touch on one thing.
We just got one more.
Okay,
So sorry. A child with unlimited energy, so he's often wired, can't focus. How do you slow them down when they're in that mode?
Yes. Great question. And then I have one other thing I want to be sure to talk about.
Right.
But yeah, so that, so how do you slow a child down? There are, let's say, there are conditions that kids have that, like ADHD, where they can be harder to slow down. That's actually, just part of their makeup, and so they may need intervention for that. A kid who doesn't have ADHD but has a lot of energy, and they just don't like taking breaks. So it's funny because for those kids, you don't want to do the real energizing coping skills. They might want to do the muscle relaxation and move around or push-ups or something to regulate, but maybe that's too much for them. So maybe trying to help them slow down. You can have them push against a wall, like try to push and take a break for a second, and I bet you can't push this wall over. But that's one way to help them tune into their bodies, hopefully slow down. And then maybe it's like, okay, you're so tired, let's lie down for a second and take some deep breaths. Hopefully, that would happen. But yeah, that is tough. Sometimes kids might benefit from running around the block or going for a bike ride to help them manage their emotions if they really do prefer to do it in a physical, energetic way. But I'll try to teach them the flip, the other ways of doing it, which are more relaxing. And then on the opposite end, the kids who are kind of low energy, who are kind of really sluggish, that's you really want to teach them ways to kind of get energetic and get some, get their blood flowing and kind of cope with feelings in that way. Yeah.
And you said you had one other thing.
So one other thing I wanted to mention. So, there are a lot. Okay. So in the last 2 minutes, one other thing, we, as parents, sometimes want to protect our kids from having feelings. We want to make sure they never, have make a mistake or fall or, experience a bad feeling, avoid situations, fail. And that can lead to maladaptive emotion regulation, meaning that if you never experience a feeling, you don't know how to identify it, you don't know how to cope with it appropriately. So we want to make sure we're allowing our children to make those mistakes and recover. And so I just wanted to mention that.
Yeah, I love that last note because I think it's 100% important. Like, nobody's perfect, and we can't teach our kids that they're going to cope with everything perfectly.
Exactly.
So, emotional regulation, thank you so much for joining us.
Thank you.
Please feel free to reach out to us if you have further questions. And yeah, thank you for joining us on this In Dialogue series.